Hi, it's Nathan and Rachel from I Need IVF, and we're here today to talk to you a little bit about the IVF process and the timeline that's involved with that. And now the clouds come over, so if it starts raining, we may have to pop inside.
Good old English weather.
Absolutely. So let's get on with it a little bit. So in this video, we're going to take it from the point that you are being referred in. So you've had your fertility testing, and you've got a diagnosis, and so you've been referred for your IVF. So that referral process, normally with the patient charter, you're allowed to actually choose a local IVF centre, and they'll put a referral in. And ours took about 6 weeks?
Yeah, about that until we got the first letter.
Yeah, and I'd say that's around average. However, some are sort of 10 to 12 weeks from a referral point of view. And then you go in for your initial meeting. Which I think Rachel's going to have a little bit of a chat with you about.
So the initial meeting is really basic, and to be honest, it's the same questions you've already been asked a million times over. But it's handy to have information to hand when you go in for it. So they'll go through your medical history, they'll go through kind of your fertility history. So how long have you been trying? What are your periods like? Kind of all the same stuff you've gone through. Good to know. Don't worry, he is getting menopausal in his old age. So they'll go through all of that with you, and they'll kind of discuss your diagnosis with you, any kind of things you've already tried through that diagnosis. So if you have PCOS, they might look at whether you've done drugs such as metformin or Clomid. If you've got a diagnosis of endometriosis, have you had any surgery because of that, or kind of what options have you kind of already considered and done? And then they will give you a very, very brief account of IVF and what that entails in general, but there's nothing particularly detailed about it, but they'll kind of just go through the whole thing with you.
And the detail bit comes at the next meeting, doesn't it? So about another week or so. Ours was 10 days?
Yeah, about that. We were very lucky. We hit things at summertime, so there weren't many people going through IVF at that point because nobody really wants to ruin their summer holidays with it. So we were kind of lucky because they had quite a nice gap in their calendar with not many people going in through the IVF process, so we got in pretty quick. Yeah,
and that's the implications of the consent meetings, aren't they? So those, in a nutshell, are them taking you through your IVF treatment protocol. So from your initial discussions, they'll have decided what your protocol is going to be on, whether you're on short protocol, long protocol, which I'll let you explain a little bit about later, and how they're going to do it. And for us, the first time we went on to, in fact the second time as well, we were on a completely regular long protocol, weren't we? You'll also be given a lot of forms which talk about what you want to do with your eggs if they're frozen, embryos in the event that, say, Rachel died, Rachel lost capacity, I died, I lost capacity. So they go through all of those kind of things.
Happy and joyful.
Yeah, happy, joyful
meetings.
Joyful conversations. They are important.
Absolutely.
And effectively, you sign to give consent to treatment.
Yeah. They'll usually let you take the forms about kind of what you would want to do with your embryos away, so you can discuss it between yourselves.
In fact, I think we got those at the first meeting.
Yeah, and we took opportunity to sit down and talk in detail with each other about what we wanted to do.
It's not something we considered before.
And also they look into whether you're happy to donate your embryos to research.
Or donate.
Donate. Or donate. Donate.
We'll go with donate.
Let's go with donate. Donate your embryos to research. I can't even think of what I'm saying now. Thanks for that. Donate.
Yeah, so, and then the final thing that they do in that meeting is they teach you to inject yourself, don't they? But, exciting. I mean, for Rachel's a nurse, so she's done plenty of injections.
Not
but
on
for
myself,
me, it was a bit of an eye-opener. And they even got to test on me, didn't they?
Yeah, well, we decided, I've given a million injections, so we decided it'd be more fun to get Nathan to draw it up, and watch him struggle rather than just get me to show another nurse how you do an injection.
And I was just about to say, so I know what you're going through, ladies, but actually I'm not going to say that because it's not even. So at that point, once you've gone through all of that meeting, you go and collect
the meds.
It's huge.
The bag.
Yeah.
The huge bag.
Yeah, if you go onto our website, you'll actually see Rachel's medications, won't you? They were pretty impressive.
It was a big bag. Yeah. So there's usually as well. You usually have to go to a specific pharmacy.
Yeah.
Because there'll usually only be one or two in your local area that might actually do IVF medication. So they'll let you know where that is. And they'll give you a lovely little prescription, and you go in and you get your meds, and then you get grilled by a pharmacist about whether you know what you're doing with them, and which ones you have to put in the fridge and which ones you don't, and all of that kind of thing.
Yeah, so then you move on to the first, I guess, intense part of the process, and you'll be given like a sheet which tells you what dates you start your meds, how many you take, what you do, so it's pretty clear.
Yeah.
But if you do have any questions, do speak to your clinic assistant, it's quite important.
Yeah.
So the first part of it is what you call down regulation. Now there are two protocols around this specifically. There are some really specific protocols which are called flare protocols and things like that, but they're for people in very specific circumstances, and they're often not used in the very first IVF cycle that you'll have. But short and long protocol are pretty commonly used. So we were on long protocol, which basically means they don't time your IVF with your cycle. So you'll be on down regulation drugs for a longer period of time. Short protocol in general is that they time it with your cycle, so that you're already at a low ebb in terms of endometrial lining, follicle development, and then you only take that for about a week or so.
Yeah, I think that's right. So as far as I'm aware, obviously I did long protocol, so I'm no expert on short protocol, but I think you start your drugs not longer after you've had your period, because you've already shed some lining, your follicles have already like quantum down, and therefore you might only need, a week or so of the down regulation meds. For long protocol, I had to do 3 weeks of the down regulation meds, and I needed to have a bleed in that time to shed my lining.
So this is the longest part. It takes about 3 weeks on long, and it's about a week on short protocol in general.
About that, but it will be very specific to you, and like Nathan said, you'll have like a big calendar which tells you what you're taking and at what time you're taking it. I was on a drug called buserelin, which is pretty common in the UK here. You can either do it as an injection or you can have it as a nasal spray, and that was the one that I did first.
What's the other common one in the UK? Is it Gonal?
No, that's a stimulation.
See, nearly an expert, not quite.
Anyway, but buserelin is the most commonly used. I can't remember the names of the other ones that we use here. But,
so you injected that for 3 weeks, didn't you?
Yep.
You have to rotate your site. Remember to rotate your site.
Yep, otherwise you get very sore.
Yeah, and bruised.
And basically it puts you into what I like to phrase as a mini menopause. So you get all those delightful symptoms, ladies, that you might expect during the menopause, like headaches, hot flushes, generally feeling crabby, and just being a bit emotional. All of those things. The one unusual one I had was I got excessively thirsty. So about 6 days in, I started drinking about 4 litres a day, which is generally not me.
Well, from the research, actually, it's quite a common one.
Is it? Oh, there we go.
Yeah, it's shown to be fairly common, actually.
It's not one they ever mention to you, but...
Yeah, but a lot of people report it online.
Yeah.
It's interesting.
So that's good. Anyway, so that all gets you down regulated, and then at the end of that point, they'll bring you in for a transvaginal scan.
Yeah.
And that is basically a little ultrasound probe which they pop up there. Lovely. Don't worry, you'll get used to that. You'll have had a lot of them during this process.
But you did say it wasn't painful.
It's not at all, actually. And it's the good old mantra of the more you relax, the easier it is, which is, all well and good me and doctors and nurses saying that to you. It's very hard to relax when somebody's putting things up there, but the more you relax, the easier it is. It feels like pressure mostly, but it wasn't painful or uncomfortable for me.
So what are they looking at in there?
So they basically looking to make sure that your lining is really nice and thin. You barely have any lining, hopefully, and they're looking to make sure your follicles are small and quiet and not doing anything at all. Because basically, at the end of that process, they want to have complete control of your cycle and for your body not to be doing anything of its own accord.
Which is a good point. So now we'll move on to stimulation. Stimulation protocol.
Stimulation sounds very exciting, doesn't
It's not.
it? It's less exciting. But essentially, it's where you start your drugs that are going to build up lots of juicy follicles and turn you into a follicle factory.
Bunch of grapes.
Bunch of grapes, absolutely. Big bunches of grapes hanging either side. So what they're looking to do there is basically create a larger number of follicles than would be typical, and they're looking to get them to a decent size. So a decent size is usually somewhere between 12 and 20 millimetres per follicle, which you can imagine what that feels like if you've got a few sitting there. So you'll start probably daily injections, but your dose will be set by your clinic based on your circumstances and your diagnosis and things like that.
As a general rule, it lasts anywhere from about 8 days to 2 weeks, maybe just over, depending on how you react.
This bit is the really tailored bit, because you will react totally differently to another person on exactly the same drugs or exactly the same dose. It's all very specific to your body. So I tend to stimulate rather well, so I tended to only be on stimulation drugs for maybe 8 to 10 days, but other ladies will need a bit longer, and some may have shorter, depending. But about 7 days into your drugs, you will have another transvaginal scan, and they will basically be looking at how many follicles you've got on each ovary and what sizes they are. And they will adjust your medication throughout as they feel they need to, and they may adjust your egg retrieval date as well, depending on how you're responding.
Which is what happened to us in the first one,
in
wasn't
both,
it?
in fact.
In both, yeah. So they bought ours forwards.
Yes.
2 days?
3 days in the first and 2 days in the second, I think. But yeah, so they're looking for those nice follicles, and they're also looking at your endometrial lining again, but this time they want it nice and thick. So ideally, I think most clinics like it somewhere between 11 and 13. Some ladies may not be able to achieve that with their lining, and then in that case they will adjust those kind of aims for your specific circumstances, because it's not always achievable. But mine always had nice healthy 12 to 13 millimetres, which was fab. These drugs will make you feel a bit heavy, bloated, crampy, and all of the other kind of things we've already mentioned. Headaches, possibly, hot flushes can still happen, and just generally feeling a bit emotional.
I think one of the important things to talk about at this stage is expectations, because online you'll see an awful lot of people who get, say, 20 eggs. In fact, one of our friends recently has just got 32 follicles, didn't she?
Yeah.
So everyone does react differently, but it can be as low as 3, and in fact in the UK they don't deem an IVF a failed cycle unless you have less than 3, so 2 eggs that are harvested from your follicles. So it's important to set your expectations. I mean, Rachel and I, when we had ours, we got 7 and 9 respectively, was it?
5 and 7 respectively.
5 and 7.
Yeah.
So yeah, so we got 5 and 7 respectively, which we were actually really disappointed about, weren't we, at the time? But having now spoken to a lot of people, it's not that uncommon.
No.
So just be aware that you'll read an awful lot of people who get a lot of eggs, and some that get very, very few. Your body, as Rachel quite rightly said earlier, it will react in its own way, and don't be disappointed, because things can happen even if you don't get that many follicles. So
this is what happens with 7. So so happy days. Definitely. And remember that a lot of the stuff you may read online is from clinics in the US or abroad, where they do tend to really aggressively stimulate you, much more than we do in the UK, because clinics in the UK are very mindful of ovarian hyperstimulation syndrome, which is one of the biggest risks that you have with stimulation. We'll go more into that on another day, but that's pretty much stimulation.
I guess leads us very nicely on to trigger shot. Yeah. Any questions, just pop them down in the comments section. We'll be happy to answer anything, really, won't we? We're not shy about coming forwards. We like to talk about our experience, or even if they're just specific questions about any section of the process. Don't forget to hit that subscribe and like button if you did. We are a new channel, so we're trying to build it slowly, aren't we?
Yep, so every little helps.
Absolutely. So thanks for your time, and have a fab day.
See you later.